Hi there, Kristen here to talk about endometriosis because March is Endo Awareness Month. So endo is when our cells that should be lining the uterus find their way outside of the uterus, and they tend to wreak all kinds of havoc in our abdomen. And so this can cause a lot of symptoms. The most common is painful periods, right? But it can also cause a lot of different symptoms such as pelvic and low back pain not related to our cycle, pain with urination, bowel movements, bladder pain, gut pain, even things like decreased fertility, severe fatigue, headaches. All of these things can be signs and symptoms of endo as well. Pelvic PT can really help because of the way that our body reacts to endometriosis. And that is our brain panics and it wants to curl up into the fetal position and pretend that nothing is happening. And so our pelvic floor muscles get really tight and tense, and that creates more pain because then we have knots in the muscles. There's tension there. It doesn't feel good. It's irritating those nearby pelvic structures, and that can kind of lead to this snowball effect, right? So we can help to really manage that pelvic floor tension and relieve some of those symptoms there. We can teach you strategies to maintain that managed pelvic floor tension so that we don't get back into that negative cycle. We can rewire that panic response by utilizing some graded exercise and some hands-on techniques. We can talk about period or pain flare-up plans. There's a lot of different ways that we can kind of help to make endo a little bit more manageable and keep you up and moving and doing the things that you want to do, right? So this is your sign. If you think that you're experiencing or you know that you're experiencing endometriosis, you better have a pelvic PT on your team. Here at Peak, I know that I love to treat endometriosis. It is one of the most challenging but also rewarding things to treat because endo is a stubborn little booger, but when we make breakthroughs and even small changes in symptoms that are so severe and have been going on for so long can make such a big difference in quality of life. So I'm really happy to be able to kind of be a part of people's teams as they're managing endo. So I hope that you learned a little bit more about endo today, and I hope that you go teach somebody else.